As a nurse, the biggest thing that keeps me up at night is working with providers who are unable to have the difficult end-of-life conversations with patient family members. And these patients end up being transferred to facilities. Generally, where I live, these facilities are either out of state or 6, 7, 8 hours away. And when these physicians are unable to have the conversation with the family about the actual prognosis of the patient, these patients are now being transferred far away, oftentimes not making it to the receiving facility, or getting to the receiving facility and then passing away before the family is able to get to them, instead of the family being able to be with the patient in their final hours. As the nurse, the doctor not being able to have these conversations, it puts us in a hard spot, because we know they're not going to make it, whether we're the transferring nurse or the transport nurse. Oftentimes myself as the flight nurse, we know these patients aren't stable enough for transport. We know that they're either A, not going to make it to the facility, or they are going to pass shortly after our arrival to the facility. And where we generally transport from, our patients' family members are quite a few hours away. So when the providers are unable to have these conversations with the family, it prevents them from being able to be there with their family members as they pass. I also believe it kind of gives a lot of family members a false sense of hope, that I've had physicians say to them, well, they have a 0% chance of living staying here. Their only chance is being transported to this other hospital. But instead of actually articulating to the family that this patient has gone into cardiac arrest 4 times in the last hour, they're on numerous vasopressive medications, the end is very near, and letting these family members be here and grieve, they're giving them a false sense of hope of, well, if the flight crew takes them, or whoever it is takes them, then they stand a chance, when that's not typically the case. And we're not only giving family members false sense of hope, they're not able to spend the time with their family